You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, interesting topic. My first guest says, don't let your fear of the dentist keep you from having the smile you've always wanted. We're talking about sedation dentistry. With us, we have an expert on the topic, Dr. Walden. Dr. Walden, welcome to the program.
Thank you.
All right, now before we get into today's topic, very interesting, by the way, because we've talked, and I didn't realize how many people are so afraid of this. Yes. But tell us about your practice. Who's the typical patient and what are the procedures that you do?
I'm a general family practitioner. I see kids to the elderly. Probably more typical patient is a working professional, older family type. We do everything from sealants. We do white fillings. We do crowns, bridges, inlays, onlays. A lot of cosmetic. We do sedation dentistry. We do lumineers, veneers.
Okay. How long have you been there, by the way?
Been at this location for 9 years now.
9 years. Okay, so you have thousands of patients. Now you told me, and this is very interesting on the phone, you said you've always liked, you said, I'm going to quote you exactly, you said, I'm a low-key guy, and I like working with people that are a little nervous. Yeah. Why is that? Because I talk to dentists and say, oh my goodness, I don't like that kind of a patient.
I know. I always have liked helping people get through a difficult situation.
Okay.
You're very correct about the fact that a lot of dentists don't want to deal with these patients. I get referrals. Once friends of mine know that I'm doing sedation and I deal with that type of patient a lot, I'm getting referrals from them.
When we're talking about anxious patients, you're telling me some of the people don't even want to get out of the car.
Oh yeah.
Is that right?
Yeah, many times we've had to go in the parking lot. And
do you go in the parking lot and get them?
Generally, you know what?
Or have you ever, I should say?
I have went to the door to say hello, but we've had a number of people that it took some convincing to get them in the door.
Okay, then do you see transformations? People that were afraid of the dentist, and then after they get a couple of procedures, IV, that now all of a sudden they're not afraid of the dentist.
There's a certain percentage of them. Absolutely, it's amazing. It's like they kind of get over this hump, and then they feel like, okay, yeah, I can do this. I got my confidence back. I can do this. And then there's some that, every time they come in to get their teeth cleaned, they need to be sedated.
Really?
Oh yeah, absolutely. So it can be a challenge, but it's also very rewarding. I try to get them engaged in taking their mind off of what we're there for. And,
okay.
And when I designed my office, I didn't want it to look like a dental office. And, in front of the patient, when they sit in my chair, they can't see any dental equipment, dental anything.
Is that right?
Yeah, I have art on the wall, silk flowers, that type of thing. So in their view, they see nothing. And when we're done, we're able to kind of put everything out of the way, so they just, they don't see all the scary stuff.
And we should mention, your background. You're a very successful dentist. You've owned many practices.
Yes. Over
the years, and but you work out of which practice? I guess you have
my Chandler office is my main office.
Chandler,
and that's where I spend the bulk of my time. So
highly anxious patients. So who is the typical sedation patient you see? Age ranges, and what are their fear levels?
Well, you know what? What's interesting is there's a lot of different types of sedation patient. At first, when I first started doing sedation, it was the typical people that you would think. They were just highly anxious, haven't been to the dentist in years, very nervous, and almost to the point of being ill.
Really? Okay.
And that's what I expected to see.
Okay.
And as it turned out, you've got the very nervous patient that is not getting any dental work at all. There's another group that'll get the bare minimum of what they need, although they would like to do more. And then you get the working professional. They don't have a lot of time. And so they're able to come in an afternoon and get all their work done at one time, and they want to do sedation and just work.
Is there, okay, so the busy type A, you can get like what normally would take 3 or 4 visits?
Oh, easy.
All in one day?
Like
how many hours? What's the length of some of these?
Well, typical is about 3.5 hours, sometimes 4 hours, depending on what we're doing.
It must make it easier on you, by the way. If they're relaxed.
Absolutely. It makes the whole situation easier, low-key, less stress. When I'm with a sedation patient, I'm there. I'm not seeing any other patients.
That's IV sedation.
IV sedation.
Is that true that less than probably 3% of dentists in the U.S. do
Yes.
IV sedation? Is that right?
That's true. That's true. There was a big push a few years ago. Well, oral sedation got real popular about 5-6 years ago. And I tried it, and what I found was that it was
That's a pill?
That's the pill.
Okay.
You know, you give the patient a pill, and they sit out in the waiting room until it kicks in, and I felt like it wasn't controlled very well. You know, some people in 10 minutes they were way over sedated, and other people, you know, an hour later they're like, I don't feel anything, and so it wasn't anything that I felt like. I just didn't feel like I had the control that I wanted with that situation. And, you know, I guess for maybe somebody that's very, very mildly anxious, it might work okay. But I don't feel like it's effective.
Okay, but you're saying, I mean, we've talked, IV sedation is safer than oral sedation.
Absolutely.
And that's a part I don't quite get. Because
Absolutely.
It seems like IV sedation
It's been proven that it's absolutely safer. And the reason is, the oral sedation, it has to do with absorption. When we take it into our stomach, it's got to get through our stomach to get into our bloodstream.
Probably.
Yeah, and it's got to be metabolized. And people metabolize things at different rates. So for one person, they may metabolize it really quickly. Some people, it may be real slow. With the sedation IV, the medication goes right in the bloodstream. Once we administer the drug, within a minute, we start seeing the effect.
Is it true you can also pull them out faster as well?
Absolutely.
Whereas with the pill, you got to wait.
Right, right. If I feel like we need to pull them out, or I try to keep them in this happy window, in there, where they're comfortable and relaxed, and you know, they can respond to a question. If I need to ask them something, they're protecting their own airway. And if I need to, I have a reversal drug that I can use to just pull them back a little bit.
So this is not like general anesthesia,
no,
where the tube is in the mouth. Because I mean, for some reason, and I almost think of that when I thought of IV sedation initially.
No, you know, general anesthesia is a totally different animal. The drug that we use, the main drug, is Versed, which is in the Valium family, tried and true, been around for many, many years. It's used in colonoscopies for the last 20, 25 years. Very, very safe drug. And when you wake up with general anesthesia, a lot of times, you know, you wake up and you feel terrible.
Some nausea, things like that.
Yeah.
So this is not like that.
Not like that at all. People, when they wake up, it's like they had a good night's rest. They feel.
Really?
Oh yeah, absolutely. Time and time again, I get people. It's just, I feel great. I feel like I just woke up and had a good night's rest.
So IV sedation. I mean, are there people that are out there that are in Arizona? Mm-hmm. They don't smile. They're miserable about their smile. But it's just that fear that keeps them from doing anything.
Absolutely.
Is that right? Even just for regular checkups?
You know what? When people get that fear that they can't get past, it affects them in a lot of ways, and then they cover it up. You know, if you ever see somebody half smile, or they talk like this, or, you know, I've had people tell me, you know, for years people think I'm stuck up, or people think I'm angry, you know, and
they're just hiding the smile.
They're hiding their smile. You know, they're afraid to smile.
But you are a dentist, and of course, I think probably every dentist thinks that the smile is the most important thing. I mean, how important is a smile as you see it?
Well, you know, I've heard it said that you know, the eyes are the windows of the soul.
Yeah.
But the mouth is definitely the doorway.
Okay.
You know, I see people all the time that tell me that, you know, I don't smile. People think I'm stuck up. People, you know, think I'm angry about something, and I've learned to cover up my smile over the years. But I think it affects people's lives in such a way that I hear about job interviews. You got two people at a job interview, right? One's got a healthy smile, healthy look. One doesn't. One covers up.
Well, obviously the one smiling looks healthy and motivated and all of those things.
Absolutely. And I hear that all the time. I have people come in and talk about that.
So in a tough economy, I mean, how important is the smile to invest in your smile? We talked about that job interview.
In the last 3 years, I've had a number of people, from executives to people looking for work, concerned about their smile. It's like, they don't want to go for a job interview and not look their best. They're executives worried about, the younger executive coming up, and they want to look vibrant.
They want to look. Do they actually tell you this on the consults?
Yeah. Well,
they want to compete.
It's been a little bit, a couple of times surprising. A gentleman that I know that worked for a major company, and his deal was he was about to turn 50, and with the economy on, and he was feeling the heat of being able to compete with the younger guys, and he wanted to totally redo his smile.
Do you think expectations are changing, by the way? On television, I was looking at old movies, and the teeth back, in the 50s and 60s were pretty bad. You don't see that today.
No.
Everybody has great teeth.
No.
Do you think that's raised the expectations or awareness about, a nice bright smile or straight teeth?
Well, people not only they're living longer, they're living well longer. I've got a group of young retired patients in my practice that, these guys are busier than I am. They're playing golf and tennis and traveling and doing this, and they don't feel old. They don't want to look old. And, I've got a few cases here.
Let's take a look. Let's take a look at what you brought. Now these, and by the way, for those of you just tuning in, we're talking about, Dr. Walden here says, don't let your fear of the dentist keep you from having the smile you've always wanted. We're talking about sedation dentistry. He does IV sedation, and says it's much safer. And by the way, as far as the needle, what about people afraid of the needles?
The way I handle this is I don't want people to get ramped up when they're coming to my office for sedation. So I give them some medication to help them sleep the night before. I give them a pill sedative to take about an hour before they come in. And
that's
so
nice.
when they come to the office, they're pretty relaxed.
They're relaxed already.
Yeah, and the IV has never been a...
Nobody complains about the IV.
No big complaints. A little bit of it's technique. You can make it harder or easier.
You're good at giving the idea.
Yes.
Okay.
Yes. And you have to be.
All right.
Who wants to go to a dentist that, every time he gives a shot, it's going to hurt you?
Do people say, by the way, I've had this IVs before, you're fantastic?
Oh, yeah. Yeah, I've
really?
had a couple of people say, next time I go to the hospital, can you come and, do my IV for me?
Dr. Walden with the technique. Okay.
Yeah.
Okay,
yeah.
So the photos. Okay, so these are patients that you say deathly afraid of the dentist, or not
Yes.
deathly, but highly anxious.
Yes.
Afraid
yes.
of the dentist.
Yes.
Okay.
Well, this lady, late 50s.
All right.
Wonderful lady. She was one of those types that she didn't smile a whole lot. She would cover it, or she would, perch her lip and not really smile. And she came in and just said, I'm sick of looking old.
How old is this person?
She's in her late 50s,
really?
middle late 50s.
That looks like a 70-year-old old mouth.
Yeah.
So what else was going on there, by the way?
Well, Randy, her smile for many years, she really didn't like it. And, and I understand why. She didn't go to the dentist like she should because she had a lot of anxiety about it. And she would go when she had to, but she wasn't keeping up on her regular maintenance. And it took us some time to get through that. We gave her some different options. We talked about IV sedation, and she felt like that was the right option for her to be able to get the things that she needed done.
Okay. So what did you do for her?
She had a lot of old dental work, needed to be revamped. There was gum problems. We went in, did a deep cleaning.
Okay.
We cleaned out some of her old fillings. We got the fillings straightened out, some old crowns we had to replace. And then once we got everything in pretty decent shape, then we were able to go back and do the cosmetic dentistry that we wanted to do. Her smile had bugged her for years and years, and she was tired of the way she felt like it aged her. And, I agreed. It did.
Is that her on the after?
This is her on the after. This is just a few teeth, but
it's clean. When
clean.
you look at the side by side, it's
clean.
Amazing.
It's clean. And she was much healthier and happier, and really made a big difference for her. Let me show you this other patient. This gentleman was he was in his early 70s, and he really, he came in the office. He was really kind of frumpy looking, and everybody was a little bit nervous about him. And he was a well-to-do fellow, you know, dressed nice. I mean, you know, you could tell he'd been very successful in life. But this was his smile. This is the best smile we could get him to smile.
Right?
And that's it. And that's it. And, you know, people...
So he looked mean.
He looked mean.
His
wife told me that he hadn't smiled in 40 years. And
sounds like a fun guy to hang out with, right?
well, you know, he was really a nice guy, but you know, he had some dental problems, and he was very self-conscious about it.
So he was another sedation patient.
He was another sedation patient, and he had a lot of challenges. Highly fearful. He would get things done when they hurt from time to time. He would go to the oral surgeon, be put to sleep, and have teeth taken out. But he wasn't in a spot that he could go and get the work that he needed.
So his wife drug him in?
His wife drug him in. He was hurting, and you know, he got to a point where he would at least come talk.
This is him smiling. Okay.
That's him smiling.
So we're thinking, oh boy. You know,
yeah. Well, you know what? When I got to look at his mouth, I understood.
Oh my goodness.
And
that's got to be unusual.
No, I see this all the time. And you know, those people you think are frumpy or angry, a lot of the time
they're hiding something.
They're hiding something.
Really.
And you know, this gentleman, he was a wonderful guy.
I mean, that's pretty bad right there.
You know,
I could see why he wouldn't
bad.
smile.
And he was in a lot of pain.
What do you mean? He couldn't eat, chew?
He had a hard time. He had a hard time chewing. It affected his speech. You know, and
So did he come in looking for a sedation dentist?
His wife came in looking for a sedation dentist.
All right. Okay. So that's how they heard about it.
Yeah, and she felt like this was the solution for him, and she drug him in the door.
40 years, no smiling.
40 years, no smiling.
Okay. Okay.
And you know, but he really was, personality-wise, that wasn't him. And you know, everybody knew it, and it was just a question of, can we get this gentleman what he needs?
And what did you do for him?
Well, we went through. We cleaned up his teeth. We cleaned his gums. We got rid of some of those old fillings that he had. We basically had to recrown a lot of teeth. We fixed his bite, and this is his after.
Very nice.
And it's age appropriate. We
didn't. And you say these people have to learn how to smile because he looks like he's grimacing.
Oh, he really struggled with smiling there at first.
When you look at the before and after, I mean that's.
Well, he had some struggles, and you know. But we saw him a few weeks later, and it was a little better. And I saw him a few weeks after that, and it was a little better. And you know, but his wife tells me now that he's smiling more than she's seen him smile in 40 years.
Okay. Okay.
So, great guy.
I mean, do you see transformations? I mean, are you ever surprised? I mean, you've been doing this a while. You fix somebody's teeth. Are you ever surprised at how it impacts their life?
You know what? I think that's what sold me on sedation very early on. Is I worked with these people. And, you know, I would try my best to talk them through it and, you know, use the laughing gas and different methods to try to get people through that. But I couldn't always do exactly what I wanted to do or what they needed to have done. And so when sedation came along, I knew what the possibilities were for people. And
does it also allow you as a dentist to spend more time? Because the patient's not in a hurry or...
Well, you
gagging.
know what?
I guess for the gaggers, I mean, this is great, right?
Oh, yeah. You know, one of my very first cases that I did was a gentleman that he was an executive in a casino, and he would get one tooth pulled out at a time because he had a horrible gag reflex, and you know, a lot of it was fear. But we talked about it. We went through the program. I gave him some options, and when we did his sedation, he didn't gag one time.
I mean, especially for the people that are mouths in a disaster. I mean, it sounds like, I mean, why not IV sedation? I mean, it doesn't cost a lot of money. I mean, I know the fees you're charging. I mean, it's really it seems like everybody would want to do it. Well, they just don't know their options, or what's your take?
Well, some people don't know their options.
Because most dentists don't do it.
No, and it's not, I mean, surprising in this day and age, it's just not out there that much. And a lot of, you know, they don't really train you a whole lot in dental school to deal with this type of patient.
And you like it. I mean, you like the person that's a nervous wreck, you said. I mean, is that right?
Yeah. Well, you know what? I mean, there's a big reward. The other end is, you know, you're doing something for people that probably nobody else can do for them. And
I mean, when you drive home, or, I mean, do you ever say, man, I really changed this guy's life?
Yeah.
Really?
Yeah.
Okay.
And if you want to know why I do it, that's why I do it.
That's why you do it.
I think as a dentist, I mean, you fix people's teeth and you enjoy them and you use stuff, but there's people that you can impact their lives, and that's what sedation allows me to do, is to really make an impact on these people.
Now we are just about out of time, but a couple more. Probably time for 2 more.
Yeah. Let me show you this one. This is a lady that hated that space in her teeth. It's called a diastema. She's in her early 60s. Hasn't been to the dentist like she should. Very afraid. We sat down with her, took some x-rays, gave her some options.
Do they come in with excuses? I mean, when they're afraid, I mean, she sits in front of you.
Yeah.
And like, what does it sound like?
I sit down and just have a discussion with them that it's okay. It doesn't matter why you're afraid. You're afraid. And we're going to deal with that. Okay, but we don't have to worry about why. We're not trying to cure you. We're just trying to help you get what you need. And we had that every time I have that discussion with my patients, had that discussion with her, and then she opened up. I've hated this space in my teeth since I was a kid. What can we do about it?
So how many years did she hate it?
She was, in her early 60s. And
so 50 years, 55 years.
Yeah, always bothered her.
Didn't smile because of it, by any chance?
Well, she was one of those people. She'd try to grin and then she would
hide it. Okay. So tell me what you did for her.
Well, under IV sedation, gave us the time to do the things that we needed to do for her. But there was a few crowns, some fillings, whatnot, some veneers.
All right.
And this is this lady's after. Very age appropriate. Okay. She didn't want to look like a 19-year-old.
When you say age appropriate, meaning not too white?
Not overly white. I'm sure you've noticed, little old ladies with bright white smiles, and
I haven't, but I guess they're out there, right?
Yeah, they're out there.
Okay.
They're out there. But we try to give them a nice.
Let me see that again, side by side, because that is a big difference. Okay, so she went from so it's kind of like a new lease on life in a way. I mean, you go from someone with a really bad smile.
She was thrilled when she woke up and she saw what she had. She was.
What happens? I mean, is it emotional?
Oh, for this lady, it really was, because it had bothered her for so long.
Do you get secretly excited, I can't wait till she sees it?
Oh yeah.
Really?
Oh yeah. I mean, that's kind of the funnest part, is when you're done and it's like presenting. Here you are. Here's how you look.
So IV sedation, they're not groggy. I mean, can they drive home or no?
No.
So you still don't want them to drive home?
No. We want somebody to take them home. Let them relax. They usually sleep it off in a few hours. By that evening, they're ready to go out to dinner, whatever they.
I think you told me this in the phone. I mean, of all the patients in dentistry, these are like the happiest group, the most grateful group.
Oh, absolutely.
Like what? I mean, they want to give you a hug, or they send you.
Lots of hugs and nice notes, and I've got a couple that still bring me, chocolates or baked goods, or I mean, they're just really thrilled, with how it's changed for them. It's really fun to see, a guy that looks kind of frumpy and comes in, and you give him a new smile. And you see them the next time, and they're dressed in different clothes, and then the next time you see them, they've got a haircut, and it changes who they are, and they feel better about themselves. You see more confidence. It's a great thing. It's very rewarding for me as a practitioner to be able to do that for people.
So these dental phobics, I mean, is it considered a real phobia? A lot of people.
For some, it's a horrible phobia. For a lot of people, they're highly anxious. Is it a phobia? Isn't it a phobia? It's really hard to say. But the way I look at it, if it's keeping them from getting what they need, dentally, the sedation's the way to go.
So so the categories, as a recap, and we're out of time. So the busy executive, the busy CEO, female, runs a company, whatever, and has a bunch of things going on, doesn't have the time. Nobody likes going to the dentist. Back and forth.
Right.
You can do multiple things, a lot of things, even over a 5-hour period.
Yeah.
As far as because there's 5 minutes.
5 minutes.
And you can do a lot of dentistry all in one day.
Yeah.
That's the one time. Then there's the people that are completely afraid.
Yeah.
And those are. And so, what about your skill level? Okay. Mm-hmm. I mean, is there a job too big for you? I mean, can you pretty much handle most full mouth problems?
One of the reasons I didn't do sedation earlier in my career was I felt very much that you know, you needed to be at the top of the game to be able to do that. And it was very important to me to be able to provide that. So it took years of practice.
You go a lot of continuing ed?
Oh, all the time. All the time. Just finished.
Is there really that much to learn, really, about this?
Well, you know what? One of the things I really like about dentistry is it's changing all the time. And there's always new materials, new techniques, and you either spend a lot of time staying up on all that, or you fall behind and you practice the way they taught you when you were in dental school.
Are there guys doing that?
Oh, yeah.
That's not you?
That's not me.
Okay, good. Well, you know what? We're out of time, and final message. Somebody that is really afraid, even watching this might make them nervous. What do you say to them? Where does it begin? Come in and at least meet you?
You know, the big thing is you aren't alone. There's lots of people. I mean, amazingly, there's a lot of people out there that are very afraid, very anxious to go to the dentist. And, you know, you have to know that there's people out there that can help you.
Somebody said, I talked to a dentist knowing that you were going to come on the show. He said, he goes, statistically, it is safer to do IV sedation on somebody than no sedation at all. What does that mean?
I've had a number of cases where, you know, the person had heart troubles and this and that, and their cardiologist sent them to me to have their dental work because they didn't want them getting really
anxious during the. Oh, okay.
Yeah.
Blood pressure goes up.
Blood pressure goes up. They start feeling lousy. They start sweating. And,
so this keeps it. And you say they wake up rested.
They wake up rested.
All right. Well, I want to thank you for coming to the show. Very interesting stuff. Now they can look at some of these things on your website.
Yes.
And they can call and see you face to face.
Absolutely.
All right. Thank you so much.
Thanks, Randy.
Pleasure having you on the show. You've watched the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can visit our website at wellnesshour.com. Just put in Sedation Dentistry. You could put in Dr. Walden's name. You'll find him there. You could also follow us on Facebook. We're also going to be putting this on our Facebook page. For now, I wish you good health.